Okay, so for this question, it asks firstly, what is the definition for health outcome? So health outcome actually has many factors. You can believe it's a result of paying more attention to the health. So what is the outcome of it? What is the death rate? What is life expectant? And what is the rate of medicine supplying? And what is the rate of recovering from disease? Those are all the kind of health outcome that can be used to compare among countries. Okay. And the second part of the question asks how do health outcome in the United States compare with those of other high-income countries? So we do have some data in the textbook. For example, it say that the United States spend a more per person on healthcare than to other high-income countries. And the United States has lower life expectancy, higher infant mortality, and a greater incident obesity than to other high-income countries. Those are bad factors. But the United States have more medical technology per person and has lower mortality rate for people diagnosed with cancer than to other high-income countries. Those are good factors. So we have many kind of health outcome that can be compared among countries. So the last part of this question asks, what problem arise in attempting to compare health outcome across countries? Okay, so I can think of several of them. The first one might be data collecting. So if we want to compare among countries, we need to use the data collected by different countries. But different countries might have different ways to collect data and to summarize data. So sometimes we use those among country data. It's hard to compare. And the second one might be health insurance. We know that in the United States, we have two kinds of health insurance. One is private insurance bought from the insurance firm. The other one is insurance provided by the government. But in some other countries, all the insurance are provided by the government. So if we want to compare the United States with those countries for the government providing all the insurance, it's really hard to compare, right? And about rate of speed of services. Some countries, like United States, we always need to make an appointment before we're going to see the doctor. But some countries, we can always walk in, and the doctors are always working very hard to see every patient that works in. So the speed of service is quite different. So that makes us less easy to compare. Okay, and some other thing like the lifestyle difference. So in some countries like United States, eat a lot of fast food, but in some other countries like Asian countries, especially Japan, they, they eat very healthy food. So in general, they're much more healthy and less likely to get some like obesity, those stuffs. So it's really hard to compare. So that's kind of factors that make it hard to compare among countries about their health outcome.